My name is Jennifer Figueroa. In this video, I am going to provide examples of activities that can be done to complete the thinking program. The first step of the thinking program is to transform negative thoughts into positive ones. One activity that can be performed to achieve this is journaling. You will be writing your thoughts to become aware of them and to analyze them. This activity may be done on your free time or before bed. You are going to get a journal and you are going to recall any stressful situations that happened during the day or the week. You are going to write your thoughts and feelings during those situations. The first step to recognize negative thoughts is to recognize common thinking errors. Common thinking errors are thought processes that can include catastrophizing, overgeneralization, black and white thinking, personalization, and fortune telling. Here, we can see examples of each of those errors. We can see that they are a way of thinking that goes to extremes. Do you recognize any of these kind of thoughts in your journal? If you found one or more of those kind of thoughts, you are making one or more of the common thinking errors. To change this, we're going to analyze those thoughts. To analyze your thoughts, you will need to answer the following questions sincerely and in detail. Think about it and take your time answering each. We're going to look at a made-up scenario of a nurse to observe how she completes this exercise. Nurse Janet is frustrated because one of her patients is being rude and uncooperative. She thinks, I am not appreciated in this hospital. Patients are rude and uncooperative. They are so ungrateful. This is not worth it. At the end of the day, she takes a notebook and a pen and writes down those thoughts. She proceeds to answer the questions. You can see that in her way of thinking, there are some of the common errors we mentioned earlier, such as overgeneralization and catastrophizing. We can see how Janet was able to analyze her thoughts and even mentioned how some patients were very good, contradicting the overgeneralization statement she made earlier. By answering these questions, you're becoming aware of your thoughts and giving yourself an opportunity to challenge them and eventually change them. Now, negative thoughts are a bad habit. You can expect to change them in a day. You have to practice these activities regularly to be able to change your negative thinking habits with time. The second step of the thinking program is to put more emphasis in the positive aspect of negative or stressful situations. With the techniques you learned earlier, you should be able to identify your negative thoughts. By identifying your negative thoughts, you can see the perspective you have on the situation and you can come up with alternative perspective to look for a more positive one. To do this, you can take a piece of paper or your journal and write all the positive points on that situation. Think of as many as you can. We will continue to use Janet's example to explain this technique. In this exercise, Janet takes a moment to think about the situation. On a piece of paper, Janet comes up with this table. You can see how Janet was able to identify good things in her job. She realized that not everything was bad. When we identify and focus on the good things, we will be able to make the situation less stressful. Now for the third and last exercise of this video, we're going to use one of the most common relaxation techniques to interrupt pessimistic thoughts, which is the third step of the thinking program. This technique is the first step of the many other techniques such as meditation and yoga. That technique is focused breathing. When you are in a stressful situation, you focus on your breathing and start taking deep breaths. In the case of Janet, she can do this a minute or two before entering the difficult patient's room. Before entering the room, she would focus on her breathing and inhale slowly enough to be able to do it for 5 seconds. After counting 5 seconds, she would hold her breath for 5 more seconds. Lastly, she would exhale slowly, counting 5 more seconds. She would count 5 more seconds before inhaling again, and then repeat the process for 1 to 3 minutes, depending on how much time she needs or has. Breathing exercises are not for everyone. People with breathing disorders or heart failure may not perform this exercise. But for those who can do them, they can be very beneficial, since they offer time to calm thoughts, slow heart rate, and regulate the autonomic nervous system. This exercise can be combined with other techniques such as meditation or yoga for even better results. These are some of the techniques that can be used to achieve the first 3 steps of the thinking program for the positive thinking training. I hope you learned something and you can apply it to your life to have more productive days at work and reduce work-related stress. Thanks for watching.